evening to all of you present here. I am your host Muskan and I welcome you all to the Tip Media's live session. And today we will be talking about how do we take care of a diabetic patient. People living with diabetes often need more care. So to cater the same and to discuss what are the main pointers that can help a person who, an individual who can help somebody who is dealing with diabetes. So, to discuss the same, today we have Dr. Ishita Sachdev with us, who is a medical professional with expertise in diabetes and thyroid management. As well as she has a passion for promoting well-being, with a decade of experience in various fields of medicines and surgery, and a focus on diabetes for the past 5 years. Also, she has worked in renowned hospitals such as Breach Candy, Lilavati, and Hinduja. Dr. Ishita Sachdev holds an MBBS degree and a specialization in diabetology. I will just invite.
Hi guys, good evening. How's everyone doing?
Good evening, good evening. All good. How are you?
Wonderful.
Okay, perfect. So I've already introduced our audience to you, and you've already been there with us on the live session. So almost all our audience already knows you, right? So let's just dive in.
Sure.
Okay, so the first question for the session will be, what are the components of a comprehensive care plan for diabetic patient?
Comprehensive care plan would be discipline. Point number one has to always be discipline, because you can't say that I'll work out for the entire week only on Saturday, Sunday. I mean, we don't eat all the weeks stop only on Saturday, Sunday, right? We need little food every single day. We need little sleep every single day. So you need little workouts every single day. So discipline on a daily basis is of utmost importance. Then we go on to um, medications. We get a lot of patients saying, "Oh but my sugars are under control, so I'll stop medication." No, it is under control because you're taking medications. Okay. Then the other part would be stop believing WhatsApp messages. WhatsApp University is a whole other ball game. It creates more complications and problems than it solves. People come up with half knowledge. People come with okay, something might work for you, but it might not work for me. Something might work for you, it might not work for you. Each of our bodies are beautiful and bio individual, and that must be respected at every point of time. That is very necessary. So you have to keep that in mind. And a lot of people will sell you a lot of things saying, we will reverse your diabetes in 30 days. We will take you off medications. Your target should not be coming off of medications completely. Your target should not be coming off of medications completely. It should be ensuring you have good blood sugar, blood pressure, and cholesterol levels under control. So, absolutely. Yeah, discipline, take your medications on time, make sure that you're working out, and most importantly, reduce the stress levels in your life. I think that has to be included in priority number one nowadays. I mean, especially after Mr. Nitin Kamath, everything that he has gone through, that shows what an important factor stress plays in our lives. So, in spite of the fact that he's so fit, his physical endurance is amazing. Anyone would kill for a fit body like his. But when stress comes into play, and he unfortunately lost his father also, emotionally, make sure you have friends and family who will support you. But those bonds, you have to put in the work for those bonds as well. Why are we talking about it? Because it is extremely important to remember that all of these things make up a life, make up an individual. I'm not only treating your blood sugar levels, that's very easy to manage. But is that the target? No. A holistic well-being is the target, and everything is equally important in that. And loads of laughter, 100%. Please laugh. That's very necessary.
So moving ahead, how can caregivers help the diabetic patients monitor and manage their blood sugar?
So there are a couple of things in that. Again, be their best friends. So most of the time when we see spouses coming in, they are like, oh, but he doesn't go for a walk, but she doesn't listen to me, she doesn't take time out for herself, and they're just pointing fingers and they're just going fight, 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 fight. Okay, I'm sure that comes from a place of love and care, but that's not how the other person sees it. Sometimes the other person just wants someone to talk to, especially if it's a woman. She just wants, just ask me how my day was, just ask me how much I fought with the maid, because running a house is also not an easy job all the time, right? When it comes to the male partner, a lot of the times what we see is that he just wants to come home and relax. He's had a tough day at work, and he just wants to unwind. Maybe he doesn't want to talk anymore, because he just wants to go silent for those hours. That is his unwinding time. So my personal suggestion, and what I also practice, is that I always tell couples, it can be couples, it can be father daughter, it can be mother son, anybody, one member of your family, it can be your best friend, just the two of you go for a post dinner walk. It has to be like a स्लो वॉक, जिसको हम पुराने जमाने में टहलना बोलते थे. अगर आप देखते हैं आपके दादाजी दादी ये सब लोग खाने के बाद टहलने जाते थे. So that 10-15 minutes of walk, spending time with each other, that can be any relationship. It can just be two friends, father daughter, husband wife, but always for couple it works better because they get some time to talk about their day, which they will not get because you're always constantly running, you're working, you're managing the house, you're managing the kids homework, then preparation for the next day. It's a long there's a lot of work to be done in a single day, right? So you have to think of things from their perspective. But this 15 minutes is very easy, it's very doable. They can become best friends again like they did before they were married. They can joke around. It is so important to be supportive at this time. Now, if you start nagging the other person becomes very irritable. Okay, let's understand that कि अगर आपको diabetes है, if you're already living with diabetes, you're already irritable. There's everyday life has become very stressful nowadays, and we take also too much stress, the constant pressure of being perfect all the time. And I think that is what we've done to ourselves. Like, it's okay if you try, it's okay if you don't get it right. People don't let themselves be. That is a little bit of a problem, and they forget to laugh at themselves. So, again, laughing is like such an important factor of just being overall healthy, just mind, body, soul. So I think if they have that element of friendship in the relationship, it becomes very easy. So as a partner, don't nag. If your husband or wife likes sweet, you're going to a wedding, if your blood sugars are well within the control, you can have a one piece. Don't be like, oh my god, you ate one piece and now I'm going to fight with you tooth and nail. Why did you eat? You're not supposed to eat. It's life. They enjoy sweet. They've gone once in a way, once in 3-4 months to a wedding. You're eating one piece. It's okay. It's not going to bring the house down. But the other things, 90% discipline should be in place, So you can have that little bit of enjoyment and it's perfectly fine.
Amazing. So it's good if you have it in some way, right? Okay. How can caregivers support diabetic patients in maintaining a healthy diet?
Again, first is don't nag. Okay. And second thing is you have to, it's a proper well-balanced meal. And mostly what advice we give is applicable for you and for me as well, like a perfect typical Indian thali, which has a little bit of fiber, which has your salad, which has a little bit of fiber in it, which has curd, which is also your probiotic. It's great for your gut health also, and it's great for your starters because when you chew your food also slowly, it gives a signal to your brain that you're eating. And mostly when we tend to overeat is because we eat very fast. So that's how eating on time and eating slowly makes a huge difference. Okay, then baki, one protein source, one vegetable, which is again fiber and a little bit of carbs, one little bit of a gravy or a dal or whatever you like, one or two small rotis, and if you want, one small bowl of rice. You know how traditionally a lot of cultures in our country, they finish their meal with a little bit of curd rice, which is also great for your gut health. And for sugars also, it's okay to have just one small bowl of rice, it's not like you're eating an entire thali only of rice. So in moderation, everything is fine. And yeah, just overall healthy food. And if someone likes spicy food does not really affect your blood sugar levels. But yes, you have to keep your oil, ghee, tail, butter to a basic minimum. See, without that, you can't cook, obviously. So but then use less of that and avoid fried foods. But it's okay, abhi, uh, साल में एक बार अच्छी बारिश हो रही है, you feel like having a cup of tea and one small plate of bhujia, or like bread pakoda or just aloo pakoda. It's okay, like you can't be like, and life is meant to be enjoyed. Does not mean you eat fried food every single day. That is not good for you and for me. But once in 6 months or once in a year or twice in a year, if you eat it, what is the harm in that? Nothing at all. So,
Oh, okay. But how can caregivers also, encourage the diabetic patient to do exercise to be physically fit?
lead by example. Honestly, it really works, because most of the times I still remember there was a time when I took a break from walking. I didn't take it intentionally, but it just happened. Like I just stopped walking. There was this couple of events and functions and one thing after another, and I was traveling and everything. So I left my discipline, and obviously if you left your discipline, I ate also a little bit, put on a little weight, and your patients are your best critics. Okay. So they're like, doctor, you put on little weight, no? I said, yeah, I have, but I'm working out again. So they're like, yeah, I know, we see you working out. So leading by example, it's okay to, I mean, there were certain events that, disrupt your daily routine, but then you get back on it. Just as simple.
Hmm.
And, it's very easy to point fingers and say, oh, but you're not having adequate protein. Oh, but you're not working out 40 minutes, you're only doing 30. You're doing 30, Oh, but you don't work fast enough. So someone who wants to create a problem can create a problem in any situation. So firstly, the person's taking the effort, let them. Once you start feeling good after a workout, I promise you, you will not want to stop. So let them be, let them take a call for themselves, let them enjoy the walk. And yeah, just, again, that nagging factor, again, it comes from a place of love and care. But someone who's already irritable in their head because of sugar levels hai, ghar itna sara pressure hai kaam ka, etc., might not be able to look at it that way. Just support them, just talk to them. People generally want to get better, so yeah, they will make the effort, and once they do, then enjoy it together.
And how caregivers assist diabetic patients in managing stress and
Sorry, managing.
how can stress and mental health challenge?
Okay. You have to have your spiritual practices in place, chanting, meditation, they really work. Okay. If you have time, then you should definitely do it 20 minutes before you go to sleep. First thing you get up in the morning, and if you can't do anything, and if you are so hard pressed for time, just practice gratitude. That really makes a difference. That helps you realize and see the good side of things. It literally rewires your brain to look at the things positively. See that there is a set of situations given to two different people. They will react very differently to it. One can make it their biggest strength, one will keep complaining about it. And like misery loves company. If you enjoy staying in that miserable state of mind, it's very hard to get out of. But you can always make an effort, work through it. And again, definitely working out will reduce the stress levels, and when you have that dopamine rush after a workout, you will not want to stop working out. So your body will say, no, let's go. It's okay. I'll get up half an hour early. Let's go. It's fun. And your body, like, just listen to it. It will actually talk to you, it will give you, like, if your body starts aching, it starts paining, it shows that you're lacking the physical activity, or you're having less of protein, which means your muscles will start hurting, or there are vitamin deficiencies. Just give it the due respect that it deserves. So adequate sleep, working out, definitely have your spiritual practices in place, practice gratitude, and super important, have a good social circle. Because we still know for a fact that in COVID, when elderly people were locked down, it really affected their mental health very badly. And you anyways have diabetes, you're unwell, you have to take so many medications. Imagine you're stuck in a house, okay? Now, the kids in the house are doing work from home. So you can't turn on the TV, you can't do anything. You're just sitting there, right? I mean, I cannot even imagine what someone must be going through at that time. And obviously, you don't do a lot of the housework. You can just do a little bit of the cooking and all, but the rest of the things will be taken care of by the kids, as it should be. So, matlab, insan karega kya? So that does affect your mental health a lot. Go out, particularly sunsets, sunrises at that time. Go to a small garden area. That will really elevate your mood. It makes a huge difference, for sure. So there's like a comprehensive care plan.
Basically, not just for diabetic patients, but for everyone, right?
Yeah, mostly.
What are the signs and symptoms of diabetic complications that caregivers should be aware of? When should they, seek any medical?
Firstly, you should check your blood sugars often enough. If they're under control, there is very less chances of complications setting in. Secondly, the moment a patient starts complaining that I'm having a distress or I'm feeling uncomfortable, there's neuropathy, you start having burning feet, like a tingling numbness, that kind of sensation, that happens. Blurriness of the vision, your retina should be checked once in a year. Your dental health should be checked once in a year. And if they say that they're getting pain in the gums, inflammation in the gums, because a diabetic is more prone to developing dental infections. And if you have dental infections, your sugar levels control become much more difficult. So they are very much interlinked. So they have to be taken care of on a regular basis. Make sure that you don't get cuts very easily. Your footwear should be good, like typical cotton socks and shoes, so that if you're going out, if the sensation has reduced in your feet, sometimes if they get a cut or an injury, they don't realize until it festers, right? So make sure that you're wearing the protective footwear so that you don't get injured. But if you do, immediately at least do a daily or at least a weekly foot care check, so that you make sure that the foot is not injured when you've not realized it also. Yeah, those are basic. Good moisturizing for your feet and your hands. That is super important, for sure.
Perfect. So, moving, are there any strategies that caregivers employ to promote medication?
That caregivers can employ to?
What strategies can caregivers employ to promote medication adherence?
Adherence.
Like help diabetic patients manage their medication.
Oh, couple of things. You get those pill carries, that pill boxes. Never open the tablet and keep it, because if the tablet absorbs moisture from the air, it will lose its efficacy and the effectiveness that you're looking for. Okay? So always, if you're keeping the tablet, just cut it with the wrapper on. Like, don't open it and keep it, because it will lose its effectivity. So that is one thing. And you can just keep one box of, okay, these are all your morning pills, these are your afternoon pills, and these are your night pills. 3 separate boxes you can keep, and you have to just take one of these. So that will become very easy for the people who don't know how to probably read. They only identify it from the strip. I take this one in the morning and this one at night. That is very important. And if you don't know, just take the strips to your doctor and ask them, how many times am I supposed to have this? How many times am I supposed to have that? It's totally okay. That's necessary. Because generally it is the kids of the people living with diabetes who manage all this. So it's very necessary that
Mhm.
they know these basics, that sometimes the kids are not able to come because they are in the office. But if the
Yeah.
patients have this kind of query and their children are listening to this, it's very important that you send a strip ka packet with the patient to the doctor. At least they will ask, and the patient will get some satisfaction. Okay, so the doctor knows what I'm taking in the morning and night. But if they're confident, it's fine. If the kid has come to us once, we explain everything to them, so it becomes very easy. But in case there are doubts, you can always send it. Yeah.
Absolutely. Okay. So, and what resources and support services are available to caregivers of diabetic patients, and how can they access them for additional assistance or guidance?
Sources are right now very limited, but
Hmm.
you can take the help of a nutritionist or a dietitian. Probably a nutritionist would be the right word for it, because you don't want to go on a diet. You
Mhm.
want a complete nutrition and a healthcare plan or a health coach, you know, where people are not able to manage their busy lives. Say it's a 30 or a 40, 45-year-old executive who is having a little bit of a difficulty managing your life schedule. A health coach will definitely be good for a scenario like that. Health coaches are very prevalent in the US right now, but in India it's just picking up, because people are becoming from like a lower middle class to an upper middle class. The entire demographic is changing, so we will see these challenges
Mhm.
in the future also. 20 years from today, health coaches will be very, very big. Today also they are, but it's going to increase 10 to 20 years from now.
Okay, coming on to the most important question, which we've already almost covered, are there any things that a caregiver should avoid for someone with diabetes?
Don't nag.
Don't nag,
That's my
and
favorite,
you are
because see, it is something that we do see in practice. And even if my dad picked up an ice cream, I mean, he is someone who has diabetes for about 30 plus years now. um, I would say, Papa, अकेले अकेले मत खाओ, आधा मेरे साथ share करो. So it's like I'm not directly telling him no, but I'm like, okay, sharing is caring. You care about me, you take 2 bites and I'll take 2 bites. So it's like he's having his craving is satisfied, but he's not overdoing it so that his blood sugar doesn't shoot up. So that's how you can make it playful. So that's very necessary for all of us to understand. I mean, so yeah. And
absolutely.
what to
Which
avoid
also,
is don't believe false messaging on WhatsApp. Don't what. What might be true for one patient might not be true for another. Don't believe that stopping beet is going to reverse your diabetes. If it was that easy, we'd all be diabetes free today. I mean, India is the diabetes capital of the world, not just because of one factor. No, there are a multitude of factors. There is something called
Mhm.
the Omnius Octet, where at 8 pathophysiologies, 8 mechanism of actions because of which a person develops diabetes. You're just going to cancel out wheat. It's just like saying, like, I mean, come on. That's not the correct thing. And that's the most common question that we get. Every other patient asks us this question: if I stop wheat, my diabetes will go away. No, oh, I saw it on the net. I read it on WhatsApp. No, no, if it was that simple, it would be so, so good. But it's not that simple. And we are still discovering things about why diabetes happen, why the prevalence is increasing with time. So there is still a
Mhm.
lot of unknown things that are being discovered. They are unknown because we don't know them today. But the way we know it today, we're tackling it with the resources available. But just one factor, stopping wheat will reverse your diabetes, is not correct. Please do not believe such things. Ask your doctor what your questions are, and better to ask your doctor rather than believing these false messages and misinformations. I mean, people are not educated enough to talk like that. So, yeah.
Perfect. Thank you. That's all from our side, and I don't think so there are any question in the
There
comment
are
section as well.
just a few. Oh, chicken is great. It's a great source of protein. Please have chicken if you like chicken. Non-veg is a great source of protein, but avoid deep fried. So you can steam it, you can grill it, you can shallow fry it, you can make it in so many ways. And in India, the advantage is north to south, east to west. There are so many preparations of the same dish. You can enjoy it every single day with a new preparation. So please enjoy it. That's great.
That was all. I was a lovely Dr. Ishita, as
Wonderful,
always.
wonderful. Thank you. I'll see you next time. Bye, guys. Thank you for joining in today.
See you. Bye bye. Good night. And a very happy Women's
Thank
Day to
you.
you.
Likewise to everybody.
Okay, bye bye.